is a short video on some tips and tricks you can use to help yourself identify blood vessels. Let's get started. Okay, some tips and tricks for blood vessel identification. First off, we have arteries and veins. So arteries are important because they carry blood away from the heart. Now, you might always think of arteries with oxygenated blood. That is not the case, okay? So it's whether or not it carries blood away from the heart is when you call it an artery, okay? And arteries irrigate tissue. This is important later. So irrigate is just meaning that it brings blood to the tissue for its respective function. And then veins carry blood towards the heart. Remember, don't say it's all deoxygenated blood because it's not. So yes, veins carry blood towards the heart and also drains tissue. Okay, which means it brings the blood towards the heart away from the tissue. Okay, so for all the blood vessels, you will need to know the names, and the names themselves are based on locations of where those blood vessels are. So we'll get into that in a couple seconds. But when you answer them on your exam in the lab portion of it, you have to include the side, so left or right, as well as the type, so artery, vein, or trunk. You also need to know where they branch from or merge into, which is just a fancy way of saying the direction of flow. So arteries branch, they get smaller usually as they are bringing blood towards the tissue, while veins merge. So they start off small in the tissue and then they get larger as they're bringing blood towards the heart. And then they also are named kind of where they are, or their tissue or organ that they irrigate or drain. And we'll see that later as well. Okay, so some vocabulary that will really help you understand blood vessel names. First off, I want to throw some vocab out there just to make sure we are all on the same page. So an anastomosis is a connection between two blood vessels. This will become important later when we talk about special circulation specifically. Then there are trunks. Trunks are large, short vessels that immediately branch. So try to think back. Do arteries or veins branch? Okay. Then we have portal. A portal is a vessel that connects two capillary beds in series. Okay, and then there's also vasoconstriction and vasodilation. These are important later on as well. Okay, other vocabulary that can help you be able to identify, or even if you don't know a vessel, give a general educated guess. Okay, so axillary is your armpit. Clavicular is close to the clavicle. You learned that bone in 201. Radial, try to think of it as the thumb side or the lateral side. Ulnar is the pinky side. Palmar means palm. The mesenteric is intestinal. So the mesentery is a tissue that it's very close to your organs. Okay. Gastric means stomach. Gonadal is the gonads, so your sex organs. Hepatic is liver. Splenic means spleen. Renal is your kidney. Iliac is referring to the ilium, which is part of the hip. Femoral is the thigh. Popliteal is the back of the knee. Tibial is the shin or the leg. Dorsal is the back. I believe in the vessels it specifically refers to the back of the foot. Plantar is the bottom of the foot. Azygous means unpaired. Hemi means half. And then saphenous is clearly visible. So these are all really good root words that you should have in your vocabulary, so then you can make those educated guesses. Plus it helps explain the vessels in location mostly. Okay, so that's all I have for tips and tricks. Make sure you check out the the next video that will be on the actual arteries and veins and their identification. All right, have a good day.